Are you wondering whether berberine could play a role in managing estrogen receptor positive breast cancer? It's a question that comes up more and more, so let's look at what the evidence actually says. Before we dive in, just to be clear, this video is for general information only and is not a substitute for medical advice. Always speak to your oncology team before making any changes to your treatment or supplement routine. Berberine is a naturally occurring compound found in several plants, and it has a long history of use in herbal medicine. More recently, it has attracted scientific interest for its potential effects on hormone-related cancers, particularly estrogen receptor positive breast cancer, sometimes called ER-positive breast cancer. In the laboratory, berberine has shown some ability to influence estrogen signaling, cell growth, and inflammatory pathways. That sounds promising on the surface, but there is a significant gap between what happens in a lab dish and what happens in the human body. One important reason for that gap is bioavailability. When you take berberine by mouth, very little of it is actually absorbed into your bloodstream. Research suggests the figure is less than 5%, meaning the concentrations seen in laboratory studies may simply not be achievable when taking a supplement. Crucially, there are currently no human clinical trials supporting the use of berberine as a treatment or preventive measure for breast cancer. NICE, the NHS, and the European Medicines Agency do not recognize berberine as an evidence-based intervention for cancer. It is not a licensed medicine in the UK. Now, the safety side of this is where things become particularly serious, especially if you are already on cancer medication. Berberine inhibits certain liver enzymes, specifically CYP2D6 and CYP3A4, which are responsible for metabolizing a number of important cancer drugs. If you are taking tamoxifen, your body needs CYP2D6 to convert it into its active form. If berberine is interfering with that enzyme, tamoxifen may not work as effectively as it should. That is a high-risk interaction. Similarly, if you are on CDK4/6 inhibitors such as palbociclib, ribociclib, or abemaciclib, berberine's effect on CYP3A4 could alter the levels of those drugs in your system, potentially increasing the risk of side effects or reducing their efficacy. There are also concerns for people taking blood thinners such as apixaban or rivaroxaban, where berberine may raise anticoagulant levels and increase bleeding risk. And for anyone managing diabetes alongside cancer treatment, berberine has a blood glucose lowering effect that could combine with metformin or insulin to cause hypoglycemia. Common side effects of berberine itself include nausea, stomach discomfort, and diarrhea. So what should you do if you are curious about berberine? The most important step is to speak to your oncology team before taking it. Do not assume that because something is plant-derived or sold as a supplement, it is automatically safe alongside prescription cancer medications. If you are also managing diabetes, heart conditions, or taking anticoagulants, make sure those healthcare professionals are in the loop as well. If you experience any unusual symptoms after taking berberine, including signs of low blood sugar, unexpected bleeding, or a change in how you are feeling on your cancer medication, contact your doctor promptly. So to recap, berberine is a plant compound with some interesting laboratory findings related to ER-positive breast cancer, but there is no clinical evidence supporting its use in humans for this purpose. It carries significant drug interaction risks, particularly with tamoxifen and CDK4/6 inhibitors, and it is not recognized by NICE, the NHS, or the EMA as a cancer treatment. Always speak to your oncology team and pharmacist before adding any supplement to your routine. If you found this helpful, drop a comment below with any questions and let us know what topics you would like us to cover next. Give this video a like if it was useful and subscribe to the Bolt Pharmacy channel so you do not miss future videos. We are here to help you make informed decisions about your health.